Welcome to the lecture on anxiety disorders and their causes and effects. So the very first disorder that we want to look at is called generalized anxiety disorder. It's abbreviated GAD. When we look at generalized anxiety disorder, we want to just give you a quick definition. So you feel anxious and worried most of the time, but the most important thing to understand here is there's no specific threat or danger. There's no reason for you to feel anxious. You just do. We refer to this as free-floating anxiety. There's no purpose for your anxiety, it just happens. The next disorder we want to talk about that sometimes goes along with generalized anxiety disorder is called panic disorder. Panic disorder is when you have an unexpected or severe panic attack, and a panic attack is marked by something that has no connection to something that's going on. So let's say that there's a tense situation and you get anxious about it. That's different from a panic disorder where there's no reason for you to feel anxious. There's no reason for you to have that terrifying feeling. People who describe panic disorders say it's feeling like a panic attack is feeling like you're going to die, you can't breathe, your heart races, and your mind just races all over the place and you can't really have a coherent thought. The next disorder we want to talk about is phobic disorder. This is when you have a persistent and irrational fear of something, a situation, an activity that you're taking part in. And when we refer to something as a specific phobia, there's a specific type of action, situation, object that you're afraid of. An example of that would be agoraphobia, where people are afraid of leaving their homes, going into public. That's just one example. I also have a list that I usually read in class, so let me just go over a couple of interesting ones that I found that were kind of off the wall. One of them is called Anglophobia. It's the fear of England, English culture, or English people. Arachibutyrophobia is the fear of peanut butter sticking to the roof of your mouth. Automatronophobia is the fear of ventriloquist dummies, animatronic creatures, or wax statues. If you think about some of those, that was kind of legitimate. They're kind of scary. Bibliophobia is the fear of books. Bolshophobia is the fear of Bolsheviks. I can never say this one. Caligynophobia is the fear of beautiful women. Chromatophobia is the fear of money. Let's see another one. Didascalaniaphobia is the fear of going to school, so it's good that you don't have that. It's good I don't have ephobophobia, that's the fear of teenagers. So if you want a full list of phobias, just Google phobias or list of phobias, and you'll be able to see a whole list of them and see some of the things that people have an intense fear of. I could never find the one that my college professor talked to us about, but it was fear of running on a linoleum floor in socks while being chased by a tiger. Okay, so the next one we want to talk about is social phobia. Social phobia happens when you're worried about being in a public situation. Sometimes kids are school phobic because it puts them in an environment with other children, with more people. So that's a really good example of a social phobia. Let's talk about how we learn phobias or we learn anxiety through classical conditioning, and then we maintain anxiety and those feelings of fear through operant conditioning. So take a look at the top situation here. So you are buried in an avalanche. That's your unconditioned stimulus. You're afraid. So that's kind of a given. What happened to bury you in an avalanche was that it snowed. So this was a neutral stimulus. Neutral stimulus becomes conditioned. So now when it snows, you are afraid. If you want to maintain that phobic fear through negative reinforcement, you just avoid snow. So you move somewhere warm and your fear is reduced. So that's a really good example of showing you how conditioning will explain how we end up with a phobia. Think of something that you're afraid of. For me, it's spiders. I'm terrified of them, but we're bigger than spiders. Why am I afraid of spiders? When we look at that fear, you look at how did it come about. I can't remember how it started, but imagine that you have children and you teach them that spiders are fun and they should be petted like we pet cats and dogs. They wouldn't have that same fear that we have. If I get a chance, I'll also post a clip, and if not, we'll watch it when we go back to school. We'll watch the clip on a show called Memory Hackers, where they show this person who's got an intense fear of spiders, and they end up getting him to pet a tarantula. It's fascinating. Okay, so next thing I want to do is talk about the etiology of anxiety disorders. I think your handout might be a little bit out of order because obsessive compulsive disorder and post-traumatic stress disorder are now not considered an anxiety disorder. They're on their own. So skip to the part that talks about etiology of anxiety disorders. First thing we want to look at is the biological factors. There is a genetic predisposition. If you have a parent who has sensitivity to anxiety, you have a good chance of having it as well. It's also been linked to the GABA circuits in the brain. We talked about conditioning and learning, so we acquire the anxiety through classical conditioning or observational learning, seeing someone else have that anxiety, and then we maintain it through operant conditioning. Continuing on, okay, there are cognitive factors, the thoughts that you go through, having a judgment that you're in danger or having a perceived threat is another good example. Your personality, if you're someone who's neurotic and has a neurotic personality, that can lead to anxiety. And when in doubt, you can always blame stress no matter what. Stress is always something that's going to bring out some of these things. Most of us can deal with stress to the point where it doesn't become a disorder, but others can't, and it leads to that maladaptiveness that we talked about earlier in our lecture about what are disorders. This shows the results of twin studies and anxiety disorders. So the lifetime risk was higher in identical twins than it was in fraternal twins, so showing that there is a genetic predisposition for anxiety. And there's also something called the preparedness hypothesis, that we have this innate tendency because of natural selection to respond quickly to stimuli that's going to be a threat to us. So we prepare, but in that preparation, it also can lead to anxiety. What I'd like you to do next is just take a pause on this lecture, and I would like you to take the Burns Anxiety Inventory. So let me bring that up on my computer, and let's talk about how to complete it. So this is the paper I gave you in class. The Burns Anxiety Inventory is a great tool to use to check out whether or not you have anxiety and whether or not your anxiety is being dealt with properly. So what you want to do is you want to read through each of these situations, and you want to think about in the last week. So it says in the past several days. Let's go to the last week. Have you had any of these feelings? So let's look at the first one together. It says anxiety, nervousness, worry, or fear. So you're going to put an X in the appropriate box here, not at all, somewhat, moderately, or a lot, and do that for all of your choices. So we scroll down to the next page. You have 33 different choices to make. And then once you go through that, then you're going to add up your X's. So X's in this column are 0 points, 1 point, 2 point, and 3 points. And then you're going to put that number at the bottom of your test, which is right here. So do me a favor and pause the lecture for a moment. And then when you come back, I'll go over what the different scores mean for you. All right, so let's take a look at the scoring key for the Burns Anxiety Inventory. Let's give you a disclaimer, this in no way means you have an anxiety disorder. This means you're just dealing with something that's making you anxious. So 0 to 4 is minimal to no anxiety. 5 to 10 is borderline anxiety. 11 to 20 is mild anxiety. 21 to 30 is moderate anxiety. 31 to 50 is severe anxiety. And 51 to 99 is extreme anxiety and panic. The next thing that I want you to ask yourself, based on your results, is there something in your life that you're going through right now that's causing you anxiety? If it is, this is a completely normal reaction. If there's nothing to cause you anxiety and you scored in that 51 to 99 category where it's extreme anxiety or panic, then maybe, yeah, you want to talk to somebody and see what's going on. What's really crucial to understand about this test, and what's nice about it, is your psychologist can take this test. You can do it with them this week. And then maybe you wait another month or so after you've been treated and you've started talking to them and having therapy, and they do it again, and they can see if you score differently. And if you score differently, that means your treatment is working. We're hoping that it would be reduced. All right, let's move back to the PowerPoint and let's talk about obsessive compulsive disorder next. So let's go here. And we want to talk about obsessive compulsive disorder. So this was removed from the anxiety category in DSM-5. It's on its own now, and it's made up of obsessions and compulsions. So an obsession is something that you think about. You can't get it out of your head. It continuously is like on a loop in your brain. A compulsion is a repetitive or purposeful act that you have to do. We call them rituals. So for example, I had a student who, when he would come into class, back when I was in room 153, he would have to trace all of the cinder blocks on the walls before he walked in. That was a compulsion. I had another student who had an obsession with the number 2. So every time he read something that we assigned, he'd have to read in pairs of 2. So if he got to the end of a sentence and the sentence ended in an odd number of words, he'd have to go back to the previous sentence and read the first word from that, or the last word from that sentence, and then continue on. Just try that sometime. Like, open up your psych book and try reading, and you'll understand how difficult it was for him to pay attention and focus, because he couldn't do that, plus pay attention to what he was reading. Okay, take a pause here. I want you to watch the video that I posted in the Drive about Mark Summers and his obsessive compulsive disorder, and then I also want you to take the OCD test. Please keep in mind that this test is for adults, so there are some adult questions in the test, and then when you come back, we'll go over your results. So take a pause here for a moment. Okay, now that you're back, the obsessive compulsive test results, if you scored 25 to 45, this is also, let me rewind for 1 second. This shows whether or not you have obsessive compulsive tendencies. This is not to diagnose whether or not you have the disorder, so don't freak out if you score high. 25 to 45 is not obsessive compulsive. 46 to 55 is mildly obsessive compulsive. It says it's adaptive and generally beneficial, so it kind of helps to keep you organized. 56 to 70 is moderately obsessive compulsive, and so that although still adaptive, you experience short periods of high tension. And 71 to 100 is severely obsessive compulsive. It says although adaptive, you may be insecure and hard driving, experiencing extended periods of high tension. I scored an 81 on this test, and I in no way have obsessive compulsive disorder, but I certainly do like things to be a certain way when they aren't, or I don't get my organization, or I miss something for the day. I do get a little agitated, but I certainly don't have a disorder, so don't worry. If you scored in that highest category, does not mean you have a disorder. Also, I want you to think about the Mark Summers video that you watched. And a lot of kids ask me, well, why would you buy a plaid couch? Why wouldn't you buy rugs without fringe? Well, he has a lot of money, and most inexpensive rugs have fringe. So you have to be able to deal with the obsessions and think about a way to deal with them. And as you saw, his treatment actually worked by being medicated, and eventually he was able to take himself off of the medicine, which is fantastic, because a lot of people, once they do that, they go right back into a spiral of the obsessive compulsive tendencies that they had prior to taking the medicine. So it's kind of cool that he doesn't have to take medicine anymore. Okay, the last disorder that we want to talk about is post-traumatic stress disorder. This also was removed from the anxiety disorders category of DSM-5 and put in its own category in and of itself. It's when you have an anxiety attack after you've been through something traumatic. So I always put a picture of a soldier on this slide, but post-traumatic stress can happen to anyone. If you witnessed a car accident when you were young, if you were raped or molested as a child, or went through something traumatic, or saw a friend or a parent or someone close to you die, these are all traumatic events that something can spark and bring them back to you. So, like, for example, a lot of vets that were in Vietnam would be sitting in a restaurant, somebody would drop a dish, and they would hit the deck and go underneath their table, just because that sound reminded them of something they went through in their battle. People who are coming back from Afghanistan and Iraq are having problems on highways, because when they were driving in their convoys, there would be these roadside bombs going off, and so just driving down the highway gives them a lot of stress and takes them right back to that wartime situation. Okay, this ends our lecture, so please make sure, if you haven't done so, I asked you to pause throughout the lecture, but make sure you take the Burns Anxiety Inventory, you watch the OCD video I posted on the Google Classroom, and you take the OCD test so you have a good grasp of everything that we've talked about so far.